I was a 16-year-old when I came to America, and just kind of looking at me, I had kind of two options: either spelling bee champion or being a doctor. At the age of 16, believe me or not, I couldn't even spell physician, so I kind of had neither of the options, and I kind of missed the boat. So I took the different boat. I spent 5 years of undergraduate career, 2 bachelor degree, went through 3 different universities, including study abroad in England. At that point, everybody figured out that I'm going crazy. I had my own moment of reflection where I realized that I'm the kind of person who likes to have a maximum human interactions and involvement with the best return in terms of intellectually, emotionally, as well as spiritually. What other profession would do that? And I come up with only one answer: is to be a family physician. Being a family physician for the last 4.5 years, certainly I'm not disappointed with my choice. I went on to get family medicine residency from Niraj Shah. At that point, I already spent about 16 years in America, as much as I spent in India while growing up. I was pretty comfortable at that point to call myself an American, and I really wanted to give back to the country where I got so much. And what better way to contribute improving the rural health of America? I found 2 fundamental problems that essentially leads into or manifests into multiple chronic conditions. One of the area is the excess abdominal weight. Rather, is it diabetes, heart disease, even to some extent cancer, gout, sleep apnea. All of these chronic conditions can be manifested from carrying extra weight. Until you don't take care of the root of the problems, you're not going to go anywhere. And when I started as a family physician, that's exactly what I try to do. I try to take care of chronic conditions. I went nowhere. And so that's where I started taking interest in how I can empower my patients and help them to lose weight. The other aspect of the problem that I found that can also contribute or manifest into many other problems is mental health. Many people are living a very stressful life, but it's really compromising their productivity. They also manifest into improper eating, lack of activities, or doing things that they obviously know that against their health. So mental health also can manifest into even physical chronic conditions. I'm a certified yoga teacher, so at a personal level, I found yoga and meditation very empowering. Keeps myself mentally and physically fit. I tend to go through various rotations. Sometimes I like running, sometimes I like biking, so I try different forms of activity so I don't get really bored. I also involved in teaching at organizations that in St. Louis, where we teach various aspects of Indian culture and values to the young individuals growing up in this country.